Hi guys, welcome to my channel. Today I'm going to discuss the cholinergic antagonist. This is a very important topic of autonomic nervous system. So let's start to our main topic. In this video, we will discuss the very important drug which is the atropine. If you know the mechanism of action, therapeutic uses, and side effects of atropine, you can learn the effects and mechanism of action of other drugs too. So because the atropine is a very important drug. So first of all, we will discuss the cholinergic antagonist, in which we are discussing the atropine. So this is the introduction. The cholinergic antagonist is a general term for agents that bind to cholineceptors. Cholineceptors included muscarinic receptors or the nicotinic receptors. These receptors we have discussed in our previous video. So if you want to learn about this, so you can go to the link which I'm going to give in this video below. So it prevents the effects of acetylcholine and other cholinergic agonists. That's why we are saying this is the antagonist that binds to the receptor and prevent the effects of acetylcholine. The most clinically useful of these agents are selective blockers of muscarinic receptors. They are commonly known as anticholinergic agents, a misnomer, as they antagonize only muscarinic receptors. Antimuscarinic agents, and more accurate terminology. So, okay, they are saying if if they only blocks the muscarinic receptor, then we can say the antimuscarinic agent, and if it only blocks the nicotinic receptor, then we can say the anti-nicotinic agents. But if it acts on both receptors, then we can say it is the anticholinergics, and we can also say it is the parasympatholytics. So whatever the effects of parasympathomimetics, it inhibits the effects of the parasympathomimetics and the reverse effects. You can say whatever the effects of the parasympathomimetics, इसका जो भी effect होगा वो उल्टा होगा. Like if there is in the parasympathomimetics, the heart rate decreases, but in case of parasympatholytics, the heart rate can be increased. So parasympatholytics, the effects of parasympatholytics are quite similar to the sympathomimetics, which we going to discuss in our later videos. So the effects of parasympatholytics are similar to the effects of sympathomimetics, and similarly the effects of parasympathomimetics are similar to the sympatholytics. So these are the alternate terms that we are using the effects of. So parasympatholytics effects are quite similar to the sympathomimetics, and sympathomimetic effects, the parasympathomimetics effects are quite similar to the sympatholytics. The sympatholytics and the sympathomimetics, we will discuss these important drugs in our later video. So in the next slide, they are telling us about some classification of antimuscarinic agents. The most important drug in it's atropine. The second one is benzotropine. The third one is cyclopentolate, derifenacin, physothiazide, ipratropium, oxybutynin, scopolamine. In these drugs, the most important one is atropine, scopolamine, benzotropine. So these are the commonly used drugs that we will discuss in our topic. So the include tiotropium, tolterodine, trihexyphenidyl, tropicamide, trospium chloride. You can learn 4 to 5 drugs among these for the classification. The important ones are the atropine, second scopolamine, then cyclopentolate is also important, oxybutynin, sulfasalazine. In the second one, they include the ganglionic blockers, which includes the nicotine. Nicotine, and this is the brand name is Nicoderm, and the nicotinicotrol inhaler, we can use it. So ganglionic blockers are also the parasympatholitics, and neuromuscular blockers, which include the cisatracurium and the panacurium, eucurium, succinylcholine, and the vicuronium, in which the succinylcholine is an important drug. You can learn by the by this prefix word like curium. The end word of these drugs are curium, onium, and you can say the ium is the last word. So you can learn by this similar words. So this is a classification of the antimuscarinic agents. The neuromuscular blockers and the ganglionic blockers are also included in this. So antimuscarinic agents are also known as anticholinergic drugs. These agents, for example, atropine and scopolamine, block muscarinic receptors, causing inhibition of the muscarinic functions. In addition, these drugs block the few exceptional sympathetic neurons that are cholinergic, such as those innervating the salivary and sweat glands. Because they do not block the nicotinic receptors, the anticholinergic drugs, more precisely antimuscarinic drugs, have little or no action at the skeletal neuromuscular junctions or autonomic ganglia. The anticholinergic drugs are beneficial in a variety of clinical situations. A number of antihistamines and antidepressants, mainly tricyclic antidepressants, also have antimuscarinic activity. This is the very important point. This point you can use for your multiple choice question, and this is the conceptual point. So you have to memorize this thing like the antihistamines, which we gonna discuss in our anti-allergic topics, and antidepressants. They also have the antimuscarinic effect. So those drugs that have antihistaminic effect and antidepressant effect also produce the antimuscarinic effect. So this is a very important point for the clinical point of view. When we discuss the effects of antimuscarinic agent, then you can understand this point. So up till now, you have to note this point and remember this thing. Then in the later, when we discuss the actions, then then this point will be clear for you. In addition, these drugs block the few exceptional sympathetic neurons that are cholinergic, such as those innervating the salivary and sweat glands. So जो muscarinic receptors के antagonist हैं, वो ज़्यादातर उन receptors को block करते हैं which are present in the salivary or sweat glands. Because they do not block the nicotinic receptors, the anticholinergics drugs, more precisely antimuscarinic drugs, have little or no action at the skeletal neuromuscular junctions or autonomic ganglia. The anticholinergic drugs are beneficial in a variety of clinical situations. So a number of antihistamines and antidepressants, mainly tricyclic antidepressants, also have that antimuscarinic activity. So this is all about we have discussed. So the point of concern for today's video is atropine. Atropine is a tertiary amine belladonna alkaloid with a high affinity for muscarinic receptors. It binds competitively and prevents ACH from binding to those sites. At Atropine acts both centrally and peripherally. In general, action lasts about 4 hours except when placed topically in the eye. When the action may last for days, neo-affected organs have varying sensitivity to atropine. The greatest inhibitory effects are on bronchial tissue and the secretion of sweat and saliva. So important point is atropine acts on the bronchial tissue and sweat and saliva. So whatever the effects of the atropine, it mainly on related to the bronchial tissue, sweat glands and the saliva. So this is the important point. So we are going to discuss the action. The mechanism of action is the same that we have discussed in the introduction, that these drugs act on the muscarinic receptor and blocks the activity of the muscarinic receptor and the muscarinic drugs and antagonize their effect. Atropine blocks muscarinic activity in the eye, resulting in mydriasis, dilatation of the pupil, unresponsiveness to the light, and cycloplegia, inability to focus for the near vision. Cycloplegia is the inability to focus for the near vision. So atropine blocks the muscarinic activity in the eye, resulting in mydriasis. Muscarinic drugs causes the miosis, which is the contraction of the pupil. So atropine antagonizes the effect and causes the dilatation of the pupil. In patients with angle closure glaucoma, intraocular pressure may rise dangerously. So you have to keep an eye if the patient have glaucoma disease, and how can you give the atropine? Because atropine can dangerously affect the glaucoma patient. It can increase or worsen the glaucoma by increasing the intraocular pressure. So you have to learn the effects: mydriasis, hyperplasia, and dangerous for the glaucoma. The second one is the GIT, gastrointestinal. Atropine can be used as an antispasmodic to reduce activity of the GIT. So this is a clinical point too. If there is a spasm which causes the abdominal pain, to relieve this abdominal pain, you can give the antimuscarine, and which included atropine. Atropine and scopolamine are probably the most potent antispasmodic drugs available. Although gastric mortality is reduced, hydrochloric acid production is not significantly affected. Thus, atropine is not effective for the treatment of the peptic ulcer. So, if there is ulcer problem, so we have to give the H2 receptor antagonist, which we discussed in the GAD topic. But here you have to learn that antispasmodic effects means it reduces the gastric mortality. In this way, the abdominal pain which occurs due to some poisoning can be reduced. So atropine and scopolamine are antispasmodic but does not cause any effect on the peptic ulcer. So pyrenzapine and M1 muscarinic antagonists thus reduce gastric acid secretion at doses that do not antagonize the other system. So this is the multiple choice question point. You have to give the pyrenzapine, which is M1 antagonist, or reduce the gastric acid secretion at doses that do not antagonize other system. So this is an exception. This is a pyrenzapine. It's a drug which is the muscarinic antagonist, but also decrease the gastric acid secretion. So this is an exception. So you have to learn this point for the clinical point of view. Doses of atropine that reduce spasm also reduce saliva secretion, ocular accommodation, and urination. These effects decrease compliance with atropine. So whatever dose we are giving for the spasm, it also reduces the saliva secretion, ocular accommodation, then it also affects on the eye and on the sweat glands and the saliva and urination. So these effects decrease compliance with atropine. That's why we are not using atropine for the antispasm purpose, because it also causes the other effects, like it causes the side effect to the eye, it causes the decrease in saliva secretion, and it also affects on the urination. Cardiovascular. The third one is the cardiovascular, which includes atropine produce divergent effects on cardiovascular system depending on the dose. At low doses, the predominant effect is a slight decrease in heart rate. So I already have told you that the parasympathetics effects are quite similar to the sympathomimetics in like adrenaline. So sympathomimetics, the heart rate increases. So in that case, the parasympathetics, the heart rate also increases. But if there is a low dose, the slight decrease in heart rate, this effect results from blockade of the M1 receptor, the inhibitory pre-junction of presynaptic neuron. This is the mechanism of action on the base of the cardiovascular where the atropine acts and how it can inhibit the receptor, thus permitting increased uh, acetylcholine release. Higher dose of atropine, so by increased acetylcholine release, there is a slight decrease in heart rate. In case of higher doses, if you give the high dose of atropine, so it progressively inhibit the M2 receptor at the SA node, so heart rate gonna increase. What is the secretion? Atropine blocks muscarinic receptor in salivary glands, producing dryness of the mouth, xerostomia. So it causes the decrease in the salivary secretion. The salivary glands are exquisitely sensitive to the atropine. Sweat and the lacrimal glands are similarly affected. Inhibition of secretion by sweat glands can cause elevated body temperature, which can be dangerous in children and elderly. So atropine effects on the secretion. It causes the inhibition of secretion by sweat glands can cause elevated body temperature. It causes the decrease in the salivary secretion and the sweating. Whenever there is a decrease in the lacrimal salivary secretion, there is of course dryness of the mouth, xerostomia. There is a clinical point. That when dryness occurs, the body temperature rises, and when the body temperature rises, it's when you can go to the fever condition, which can be dangerous in the children and elderly. So atropine has several effects, so keep an eye whenever you're using the atropine for the purpose. Okay, this is a dose dependent effects of the atropine. When there is a low dose like 0.5 mg, slight cardiac slowing, some dryness of the mouth, inhibition of the sweating. 2 mg rapid heart rate palpitation, marked dryness of the mouth, dilatation of the pupils, some blurring of the near vision. When high doses, the heart rate increases, or if greater than 10 mg, then hallucinations, delirium, and the coma. So the dose of atropine should be like 0.5, in between the 0.5 to 2. If you are using the atropine, the dose should be in between this. If it's a high doses, it causes a dangerous effect than that of the beneficial effect. What is the therapeutic uses? Ophthalmic user, because it causes the mydrosis and psychoplegia. So mydrotic care, psychoplegic care, it permits the measurement of refractive errors without interference by the accommodative capacity of the eye. Shorter-acting antimuscarines or cyclopentolate and topicamide, both are the short-acting, have largely replaced the atropine due to the prolonged mydrosis observed with the atropine 7 to 14 days or 6 to 24 hours with other agents. Okay, वो कह रहे हैं कि atropine जो होती है वो 7 to 14 days तक आपका mydrosis cause करती है, like dilatation of pupil जो होती है वो 7 days or 14 days the criteria. Instead of giving the atropine, we are using cyclopentolate and tropicamide that causes only 24 hours or the 6 hours midrosis. Phenylephrine or similar alpha-adrenergic drugs are preferred for pupillary dilation if cycloplegia is not required. So in case if you need the midrosis condition, so you have to give the phenylephrine or alpha-adrenergic drugs if you do not need the cycloplegia condition. Antispasmodic atropine is used as an antispasmodic agent to relax the GIT. Cardiovascular, the drug is used to treat the bradycardia of varying etiologies because it causes the increase in heart rate. So bradycardia, the term bradycardia means the decreased heart rate. So whenever you give the atropine, it causes a slight increase in the heart rate. Antisecretory, atropine is sometimes used as an antisecretory agent to block secretions in upper and the lower respiratory tract prior to the surgery. So we know that it acts on the saliva and the lacrimal glands and it reduces the secretions. It can use antisecretory. So after now we have discussed therapeutic uses like ophthalmic, midrosis, and the cycloplegia, antispasmodic, treat bradycardia, and treat the block the secretions in prior to the surgery. Okay, and it's also used as antidote for the cholinergic agonist. Atropine is used for the treatment of the organophosphate insecticides, nerve gases, poisoning of the overdose of clinically used anticholinesterase such as physostigmine, and in some types of mushroom poisoning. So these are the cholinergic agonists. So whenever there is a crisis occurred by the cholinergic agonist, then you can use atropine as an antidote. Certain mushrooms contain cholinergic substance that blocks the cholinesterases. Massive doses of atropine may be required over a long period of time to counteract the poisons. The ability of atropine to enter the CNS is of the particular importance in treating central toxic effects of the anticholinesterases. You have heard about the mushrooms poisoning. If there is a mushroom poisoning, it can cause the CNS paralysis. So, the antidote is the atropine, which you need to give immediately to minimize the effects of that cholinergic agonist. Pharmacokinetics, atropine is readily absorbed, partially metabolized by the liver, and eliminated primarily in urine. So it released in the urine. It means it also affects on the urine. It has a half-life of about 4 hours. So in pharmacokinetics, we are discussing the absorption, distribution, metabolism, and excretion, EDME. So EDME includes absorption. To absorption, it readily absorbed, partially metabolized in the liver. Liver will metabolize with the air or urine gets through binding of the air. What is the adverse effects? Depending on the dose, the atropine may cause dry mouth, blood vision, sandy eyes, you can say, tachycardia, urinary retention, and constipation. These are the opposite effect of the cholinergic agonist. So it causes the dry mouth, blood vision, constipation, urinary retention. If you need to treat the urinary bladder problem, but if the patient has a urinary bladder, you should go for the cholinergic agonist. But if the patient is suffering with the urinary retention problem and the bladder problem, so you have to keep an eye by giving the atropine. So it causes the urinary retention. Effects on CNS include restlessness, confusion, hallucinations, delirium, which may progress to depression, collapse of the circulatory respiratory system, and death. Low dose of cholinesterase inhibitors such as physostigmine may be used to overcome atropine toxicity. Atropine may also induce troublesome urinary retention. So low dose cholinesterase inhibitors such as physostigmine may be used to overcome atropine toxicity. the vice versa. Atropine is used as an antidote of the cholinergic agonist, and the cholinergic agonist can be used the particularly phycostigmine for the atropine toxicity because it was a dry mauserostomy and this is a dangerous condition, and also that lead to increase in body temperature, which is also dangerous for the adults and the children. Atropine may also induce troublesome urinary retention. The drugs may be dangerous in children because they are sensitive to its effect, particularly to rapid increase in body temperature that it may elicit. So this is the important point. It causes the increase in body temperature because it decreases the secretion. When secretion decreases, the body has to uh, the body homeostasis mechanism works like that its body temperature increases. So this is all about the cholinergic antagonist in which we have discussed the atropine. I have taken this topic from the Lipin quote. So if you have any question regarding this, you can ask me in the comments, and I can also provide the notes related to this topic. So you have to send me a message, so I'll be able to send you that copy of this slide. So I hope you like my video. Kindly subscribe my channel and never forget to click on the bell button. Thank you.